This is the talk show that takes a no-holds-barred approach to politics, where truth and integrity are the standard and the Constitution honored. From Renaissance Studios, this is Champion News Talk Radio.
Good morning and welcome to another edition of Champion News Talk Radio, brought to you by championnews.net, where you can get all of the latest political news. This is Carol Parisi with JacK Roeser, the founder of Champion News. And on today's show, we have Dr. Ari Friedman, pediatrician, congressional primary candidate for 2010, Docs for Patient Care and grassroots activist, and C. Stephen Tucker, insurance broker and subject matter expert for the Wall Street Journal and Fortune Small Business Magazine, and a grassroots activist. And today, it's Obamacare a year later and what the implications are. And thank you, gentlemen, for being with us today. And how are you today, Jack?
Oh, I'm pretty good. I've got two doctors here in case anything should suddenly arise.
Well, on this Easter and Passover
and that wouldn't
Sunday...
be with Obamacare's provisions, would it? Might be harder to find a doctor if that darn thing ever gets enacted.
Indeed, it will be.
That's what bothers me is, you got a provider and a user, and they usually work out things pretty well between each other. But in this case, we got a provider, a bureaucrat, and a user. I don't have much confidence in that whole idea.
Well, let's ask the experts. Stephen.
Just to go along with Jack's thought there, IPAB, which is in my opinion, the rationing panel to be set up under Obamacare. IPAB is an acronym that stands for Independent Payment Advisory Board. A lot of people don't know that IPAB was modeled after the Oregon State Healthcare Panel, rationing panel. And there's a video that's gone quite viral on YouTube of a woman who had cancer, and she needed very expensive cancer medications. And she appealed to the state board to provide those medications for her. They sent her a letter back. This is not hyperbole. This is a fact. Sent her a letter back saying that we apologize. The cost of your medication is too expensive at this time, but we will help to pay for physician-assisted suicide. Now, that YouTube video is a clip of the actual news program in Oregon. Now, this is the panel that the IPAB
Well, Oregon's got a reputation for being politically way left of center.
Oh, far left.
Yeah.
Far left.
Well, I think that it's important to point out that this particular board was not only an essential part of how they plan on cutting $500 billion from Medicare for senior citizens, but it also plays a pivotal role in the president's most recent plan to bring the entire budget deficit and our national debt down, which is that he's going to increase the power of it to cut care. It has no clinical authority. It has no clinical underpinnings. It's simply about decreasing how much we spend on Medicare. It's a rationing board.
This is Obamacare, or this board. What is the name of this board again?
Independent Payment Advisory Board, IPAB. And it's basically
Independent
Payment
Advisory Board.
Yeah, and it's comprised of 13 unelected bureaucrats who will make decisions based on what is and is not covered or paid for.
Well, when you're really sick, you're going to be awfully happy those guys are making the decisions about you, thinking mainly about their wallet.
That's right.
Well, now this IPAB, is this new? Was this in the original This was in the original legislation.
Yeah,
that thing that was 12 feet tall that nobody read before they voted on it.
And again, it's now become one of the keystones of the president's plan, the plan he put out to contrast with Paul Ryan from Wisconsin's plan. It's now a keystone of how he plans on dealing with our national financial crisis, which is to even further strengthening the rationing power of that board and to give it the mission of even further decreasing how much we spend on Medicare.
Yeah.
As a doctor, Dr. Friedman, how do you feel about this, and how are you going to best serve your patients who are also the taxpayers?
Sure. The goal of medicine, the goal of being a physician is not to save the world. It's to save each individual patient. I mean, it's at its very essence, an individualist profession. I mean, we care about who's sitting in front of us. The goal of Obamacare, the goal of the Independent Payment Advisory Board, the goal of federally sponsored clinical guidelines is to change that relationship. You know, when you walk into your doctor's office, you trust that the person you're seeing has as his or her only goal your well-being.
Well, what is that
It's
called?
one of the fundamental ethical underpinnings of medicine, which is, beneficence. You're there to help your patient. What they want is that you have the job of being a gatekeeper to getting further services. So they're going to make my financial success contingent upon whether or not I can properly ration care. And by properly, they'll have guidelines and rules and computer programs to help figure out what you get and don't get. And it'll be my job to tell you can't have those things.
Doc, aren't they already doing a lot of that because of Medicare? I know my wife had needed a lot of care, and while we were paying it independently, what I found when she did 3 months in a care facility, that what she got really was Medicare, even though we were paying for it separately, right down to the pair of shoes that are prescribed if you have sugar problems. What's the name for that?
Diabetes?
Yeah. And which required a subsequent visit to a physician and a sale of a pair of shoes to a woman who had no need or desire to have them.
Sure.
A lot of cost, but we're paying independently. Why were we subjected to the whole thing? They chased us out of the hospital at the end of 3 months, which is what you would get with Medicare,
right,
without care of whether she had received all of the care she should. I felt like I was under government care right there, and I was.
It's not a secret that
I was paying for it, but I was getting government-determined care,
right,
without judgment.
It's not a secret that most of the medical profession follows the lead of Medicare.
Or you'll get sued.
Well, that's when you establish standard of care. You're simply saying that the majority of physicians think that this is appropriate care. And even before Obamacare, the majority of patients in this country received their care through Medicare or Medicaid.
Physicians, as we all know, the important first thing you do is you make a diagnosis. And that requires a lot of judgment. That's why you go through such a fantastic long training period, both in college and in service in a hospital, is so that you know the intricacies and using judgment, very difficult thing. Requires a lot of knowledge first, but judgment is a great thing. And if you feel inhibited by your judgment about the fact that you're going to be sued if you make the wrong choice, I'm sure your decisions are affected. Now, maybe not yours, but a lot of doctors are going to give what is the safe care instead of their best judgment.
That's the mechanism for Obamacare, which is that physicians will be paid or not paid based upon whether they follow government rationing guidelines.
Safe from the lawyers, not safe from the disease.
Is that really what the best is for the patients?
Why, sure. Else the money doesn't flow. Look at this guy Edwards that ran for president on his ill-gotten gains from suing doctors and hospitals. We know what a creep he turned into when he finally got out in the public and made a mess of his life. But that guy got rich by suing doctors and hospitals, and that's a well-known thing, and I've heard it said that it accounts for about 1/3 of the cost in medicine. And it's notable that Obama won't do anything about restraining these crazy lawsuits.
Well, that would be tort reform, which would have been something that would have been pragmatic to have implemented in the bill.
Right. That could have chopped all of this care before or after Obamacare considerably. It's notable. That's where he gets a lot of money for his election. So it's hitting his pocketbook to suck up to the trial attorneys instead of us people who would like to have the best judgment from our doctors.
Well, now that we have Obamacare implemented, Steve Tucker, I'm sure everybody's insurance rates are going down now because it was to lower the cost of insurance. So can we talk a little bit about that here?
Yes. Health insurance premiums are not going down. My clients, historically, over the last 15 years, they have had increases annually of 8 to 10%, which is usually the norm. I brought a few of them with me, and I crossed out the names. But these are 4 from Blue Cross Blue Shield of Illinois, 4 premium rate increases, just so you can actually see them. This is from a client whose premiums went up.
Hey, Steve, you know what? We're going to be going to break here in 30
Okay.
seconds. And I think you've got a lot of information there to list it for our listeners. So they're really not going up. They're not going down.
They're going way up.
They're going way up.
Yeah.
And
Well, we really want to hear that information because it's coming from a source that knows what he's talking about.
we have
He's in the
our
market.
experts on. Yes, we do. Well, you know what? We will be back after our break. We're going to hear your cost in Obamacare.